Good morning, Casa Corner. This is Rob. As you can see, I'm here at Sunrise Residential Treatment Center for Girls, doing some training here with the team. Just a spectacular team. Getting to do a 2-day training going over CASA, commitment, acceptance, security, and attunement, and talking about development. Pretty exciting stuff. This is day 2. Part of the reason that I'm so excited to be here is working together to combine developmental understanding and relationship and all the neurobiology behind that, and really linking that to dialectical behavioral therapy. Sunrise specializes in DBT and certainly treating girls with meeting criteria that would be best suited with DBT. And as we all know, those are complicated behaviors and complicated emotions, that's for sure. So just excited to be here. Want to talk a little bit more about understanding that even with meeting criteria for DBT, it all started with Marsha Linehan really addressing those people meeting features for borderline personality, which by nature is very intense and complicated emotionally. Oftentimes their emotions fool them. They can't trust their emotions. They get into relationships and there's a lot of drama, push and pull. Very frustrating, especially if you're a therapist. Lots of therapists need, if you're doing the DBT and working with this very difficult population, need a tremendous amount of outside consultation because of the complexity and because of the relational dynamics that are become so intense with the push and the pull, and a lot of self-injurious behavior. Managing that can be extremely tough, and with that it's really hard to sustain this acceptance and change. It's really a difficult place to be. I'll be honest. Even with DBT is founded upon the dialectic of acceptance and change. And getting to the first part is extremely difficult. Of course, acceptance and change, but acceptance is a core central feature of our developmental understanding, of our relational perspective, everything that we do at Embark Behavioral Health and all of our programs. Especially within CASA, that caregiver moves from a place of commitment, making that a commitment, moving to a place of acceptance, and acceptance is really hard. We oftentimes get expectations in the way of acceptance, and we get frustrated, and it is really, really hard not to develop some expectations, especially when you're seeing a little bit of movement. And that's why it's so essential, and I just love being here talking about making sure that we establish boundaries and limits. When that when that individual can't trust even their own emotions, can't trust even their own cognitions on some level, it's essential to make sure that we have boundaries and limits, that those don't waver. That's what the therapist has to rely on to maintain safety and security and their own sense of well-being, and that those boundaries and limits stand for the client as well, stand for that individual. They absolutely need to know where that therapist, where the parent begins and ends, to give it structure and to establish a base to be able to then move into a place of change. It's a kind of an interesting relationship, acceptance, and I often talk about empathy. In order to effectively use empathy, you have to have those boundaries and limits. There's a term called ruinous empathy. Obviously, you can hear some trucks going by. I'm standing outside of their facility, which is just really, really tremendous. But, we talk about this ruinous empathy. That name is out there. Empathy is not this aimless, reflective place. It actually requires boundaries and limits to have effective empathy. So just excited to be able to be at a training here, talk to you guys about being at Sunrise. Beautiful day here in Utah. It's as hot as it is in Phoenix. So until next week, look forward to seeing you guys. Okay, bye-bye.